Good afternoon, Hackathon participants. This presentation is to supplement what Dr. Temmer told you this morning, and it's possibly just to give you some guidelines and structuring the application that you're busy with. We've allowed this 3 or 4 hours to pass so that it gives you an ability to have done your own research and start doing some lateral thinking. Now we're going to focus your thinking into specific channels. So let's start off. As you can see, the topic of this hackathon is how we use technology to solve mental health problems that affect productivity. It was highlighted this morning that South Africa's sick state of mental health, and what's very clear is 1/3 of our population suffers from mental health illness, and 75% of them will not receive treatment. SADC predicts an increase in suicide for South Africa. An estimated 23 suicide takes place every day in South Africa, along with a total of 460 attempted suicides. Statistics show that suicide is the second most common cause of death in people aged between 15 and 29, but some children as young as 6 have been deemed suicidal. SADC, the media liaison Kayla Phillips, said that the organization receives over 74,000 calls to its helpline since the beginning of this year, with figures showing young adults in general have been more prone to suicidal thoughts. Research indicates that 30.6% of students had thoughts of suicide in the past 12 months, 16% had made suicidal plans, and 2.4% had attempted suicide. So health system resources and responses in South Africa, between 76 and 85% of people with severe mental disorders receive no treatment for their disorder in low income and middle income countries. More than 17 million people in South Africa are dealing with depression, substance abuse, anxiety, bipolar depression, and schizophrenia. Illness that out of the top 5 mental health diagnoses, according to the Mental Health Federation of South Africa. Despite the high number, the Department of Health's annual spend only 4%, or 9.3 billion of its budget to address this crisis. One in 6 South Africans suffer from anxiety, depression, or substance abuse. 40% of South Africans with HIV suffer from mental disorders. 41% of pregnant women are depressed. In motor vehicle crashes and crimes are considered, about 60% of South Africans could be suffering from post-traumatic stress. Only 27% of South Africans with severe mental disorders receive treatment. So this presentation, this is the content. We're not going to cover everything here, but we're going to look at the definition of mental health, the importance of well-being, determinations of mental health, risks to mental health, signs of mental health, common health disorders, health system resources, state of mental health and illness in South Africa, and how we can use technology to solve mental health problems that affect productivity. We're going to briefly touch on application. We're going to talk about the target market, patient and employer challenges, designing a therapeutic technique. There is a comprehensive guide to app evaluation model, which we're not going to cover. And then we're going to discuss some top mental health apps, and then we're going to go into what is a hackathon. So a definition of mental health means a positive diagnosis of mental health illness in terms accepted diagnostic criteria made by a mental health care practitioner and authorized to make such a diagnosis. I also like this definition that comes out of the Australian Department of Health. The most common mental health illnesses are anxiety and depressive disorders. Everyone experiences strong feelings of tension, fear, sadness at times. A mental health illness is present when those feelings become disturbing and overwhelming, that people have difficulty in coping day-to-day activities such as work, enjoying leisure time, and maintaining relationships. So this is the critical component here, and this is what we're addressing today. Is present, these feelings become so disturbing and overwhelming that people have great difficulty in coping with day-to-day activities such as work, enjoying leisure time, and maintaining relationships. The importance of mental well-being. Mental health is fundamental to our collective and individual ability as humans to think, interact with each other, and earn a living and enjoy life. The topic of this discussion: maintaining a productive daily activities, maintain the ability to adapt to change and cope with stress. So there are a number of determinants of health. For example, there are multiple social factors that affect one's psychological well-being. There are a number of biological factors that also determine a person's mental well-being. So there are a number of risks to mental health, and these are some of the general risks that we need to start thinking about in our application. Our application will probably need to interrogate some of these as part of the questionnaire, as part of the fact-finding mission, or looking for signs: violence, persistent socioeconomic pressures, sexual and domestic violence, bullying, a very common thing in South Africa, particularly in schools, particularly in the workplace, psychological and personal factors, genetic factors, hostile and conflict environment, religious and cultural pressures, discrimination and minority groups, particularly LGBT, the elderly, natural disasters, social media. Social media plays a major role in causing depressive issues. National policies. Certain governments have national policies that impact on the mental well-being of people. Lack of social protection, poor living standards, working conditions, lack of social community support. Chronic health conditions, for example, HIV, maltreatment and neglect, substance abuse, a very, very common issue in South Africa with nyaopi abuse, prisoners, brain disorders, overwork and stress, and exam stress. So this hackathon is around productivity, and when we talk of productivity, we often think of the workplace. So we've put this slide up just to show the issues in a workplace that can impact on productivity. Obviously, a lot of these can also impact on productivity at home, productivity in terms of your leisure life. So long hours and no breaks, unrealistic expectations or deadlines by your employer, overly pressurized working environments, unmanageable workload or lack of control over work, inability to use your annual leave, long commute. In South Africa, typically, people travel long distances to get to work, may use 2-3 taxis, may use the railroad system, may often have to walk to work, poor physical working environment, high-risk roles, dangerous roles at work, lone working people who work alone, don't have colleagues surrounding them, difficult interpersonal relationships. People often have problems at home, marital problems at home. They take it into the work environment. Poor internal communication. Often in a big organization, there is poor internal communication. Poor managerial support. The managers don't get involved in your day-to-day activities. Job insecurity, and then poorly managed change. So there are a number of signs that indicate that a person has mental health problems. One has to consider these when developing the application. The application will probably need to interrogate people to identify, do they actually have mental health problems? So feeling sad, feeling hopeless or worthless, thinking difficulties, problems focusing attention, extreme emotional highs or lows, sleep problems, very common in the workplace, presenteeism, coming to work and yet being unproductive, often feel angry or very worried, do reckless things that could harm others, feel grief for a long time after a loss or death, think your mind is controlled or out of control, use alcohol or drugs, a very common problem in South Africa, exercise, diet, or binge eating obsessively, and then hurt other people or destroy property. There are a number of mental conditions. We are not going to go into these mental conditions. During your Google search, you probably come across all of these. The intention of the application is not to diagnose conditions. The diagnosis of conditions needs to be done by healthcare professionals who are schooled in mental health problems. But here are the mental disorders, the major mental disorders that affect people. So we can use technology to solve mental health problems that affect productivity. As the prevalence of mental health like depression, anxiety continues to grow, clinicians have turned to mobile application as tools for aiding their patients' treatment. These apps can be especially helpful for teenagers and young adults suffering from mental health illness due to their frequent use of technology as a means of communication. The apps can be helpful as a way to engage people who may be unwilling or unable to attend face-to-face therapy, and they can also provide support in between sessions with the doctor or healthcare professional. Experts believe that these apps will work best when used in conjunction with medication or with person therapy. So applications. So this is a critical slide for all of you to consider. What does a person do when they can't afford therapy but are struggling to handle a mental illness alone? They can download an app which is accessible, portable, and cost-effective. Now the question to the Hackathon team is, what is the app going to do? Is the app going to do promotion, education, raising awareness, or a myth buster? Or is it going to do prevention? Or is it going to do a combination of those things? We need to stress that the app up front should not be doing diagnosis or a health assessment. We need to leave that to the healthcare professionals. But there is no harm in spotting the signs that we mentioned in slide 9 and 10. In the application, spotting the signs of mental health illness. Will it have a therapeutic or curative component to it? Once again, that should be in the realms of the healthcare professional. It can have a rehabilitation component to it, where somebody who has gone through a mental illness is better, is under treatment. Maybe that app can address a rehabilitation process. And palliative, usually we put in palliative, and those are people suffering from cancer who are at the end of life and do have some mental disorders. Possibly the application can address those issues. The question we've got to ask ourselves, will this app have a built-in artificial intelligence? Certainly as the data starts accumulating, we can start looking at artificial intelligence. Will it have online counseling? Will it have a virtual therapist? Will there be a 24-hour helpline? So there are a few, of course, the patient challenges. Do they know what mental illness they have? So the target market is the patient. Do they know what mental illness do they have? What app do they select? And how do we overcome the stigma and discrimination associated with mental illness? So of course, in the work environment, the employer is also confronted with an employee who has a mental illness. So maybe the application needs to assist the employer in identifying mental illness amongst the staff, and maybe have a component in terms of handling that staff member. Does the employer know that the employee has a mental illness? In many workplaces, mental health is the elephant in the room. Too often employees are scared to talk to their managers, and problems can spiral. Employers need to raise awareness and promote discussion of mental health and well-being to proactively challenge this harmful culture. Can software app assist in the employer in this process? So I've put you designing a therapeutic technique. I think we've already mentioned that maybe at this stage we should avoid looking at an application that does treatment. That is in the realms of the professionals. So when an app is developed and it is ready for beta testing, there are a number of comprehensive evaluation models which will be applied to this app once it's in its beta phase. We are not going to go through all the criteria in assessing the app, but just some of the things that I think you need to bear in mind is the access to the app. Very critical when it comes to personal information, especially now with the POPI Act, is privacy and security, a very critical component. The app ultimately will have some clinical foundation, but as we said at this moment in time, the app should not try and act as a healthcare professional who is schooled in mental health issues. The app, of course, must have great usability, and then the app must have some form of data integration towards a therapeutic goal. We're not going to cover this at this early stage. So there are a number of apps on the market, and the one thing we shouldn't try and do is to reinvent the wheel. I think it's quite critical that the hackathon participants do some research and start looking at other apps that are on the market. You can see that there are apps here for suicide prevention, general mental health apps, addiction, meditation, anxiety, bipolar disorders, depression, eating disorders, obsessive compulsive, post-traumatic stress disorders, schizophrenia. So there are a number of applications already out there. For example, Code Blue, Lantern. For anxiety, there's Sanvello. The NHS in the UK will be releasing Thrive very shortly. These help to prevent and manage stress, anxiety, and related conditions. There's one for depression, Remente and Mood Path. So let's get down to the basics. What is a hackathon? A hackathon is a competition-style event, usually hosted by a tech company or an organization, where programmers get together for a short period of time to collaborate on a software project or proof of concept. The participants work rapidly and often work without sleep to achieve their task, as the event is generally only lasts for 24 hours or takes place over a weekend. So that is the definition of a hackathon. The purpose of this hackathon is to develop a software application to solve mental health problems affecting productivity. Productivity either in the workplace, at home, in your leisure time. Now, who is the target? Is it the employee or the patient, or is it the employer, or both? So we have a problem statement. The problem statement is mental health issues can cause someone to lose concentration, make it very difficult to multitask, and carry out day-to-day activities. This can lead to a chain reaction such as paranoia. Paranoia is where even if constructive criticism is given to a person, it is taken personally, damaging their confidence and impacting on their productivity, leading to inability to interact with others, and therefore they isolate themselves. So let's set the theme. Let us set the theme based on the problem statement, which is to develop a software application that can solve mental health problems that affect productivity. Here is the statement that we've already discussed. Dr. Marva, Dr. Tema, myself, Brian, Nossi are moving from team to team, and if there are any questions or any assistance, please address it at that moment in time. Thank you. Okay.